In the realm of hungry ghosts, Close Encounters with Addiction by Dr. Gabor Maté is a deep and compassionate exploration of addiction, viewed through a lens of trauma, suffering, and the effects of early life experiences on adult behavior. Dr. Maté, a physician specializing in addiction, writes about his experiences working with people affected by addiction in Vancouver's downtown Eastside, a community deeply impacted by poverty, homelessness, and mental illness. The hungry ghosts concept. Dr. Maté takes inspiration from the Buddhist concept of hungry ghosts, beings trapped in a cycle of craving and emptiness they can never fill. He uses this metaphor to explain addiction, where people live in a state of perpetual longing and dissatisfaction, seeking fulfillment in ways that can never satisfy them. This craving, he explains, is often rooted in unresolved trauma and emotional wounds. Addiction as a response to trauma. Maté argues that addiction is not a disease, but a coping mechanism rooted in emotional pain. Most of his patients have histories filled with abuse, neglect, or deprivation. By taking drugs, they are self-medicating to dull feelings of pain, anxiety, or emptiness. This perspective challenges the view that addiction is solely a choice or a character flaw, instead presenting it as a symptom of deeper issues. The brain's role in addiction. Maté explains that early life trauma and stress can have lasting effects on brain development, especially on the brain's reward and stress response systems. He delves into neurobiology, showing how trauma impacts the dopamine system, which is related to pleasure and motivation, and the stress response. When the brain doesn't develop a healthy stress response, people may turn to drugs or compulsive behaviors to feel calm or experience pleasure. Case studies of addiction. Through his patient stories, Dr. Maté gives readers insight into the lives of people struggling with addiction. He introduces us to people who, despite their struggles, exhibit resilience, humor, and humanity. These narratives reveal how trauma is often passed down through generations, perpetuating cycles of addiction and mental illness. By connecting his patients' backgrounds to their addictions, Maté shows that addiction cannot be addressed without addressing trauma. Society's role in addiction. Dr. Maté argues that modern society itself encourages addiction. Our culture promotes the idea of instant gratification, materialism, and relentless competition. This societal pressure, combined with inadequate mental health support and the stigmatization of addiction, makes it difficult for individuals to break free from addiction. Maté critiques the criminalization of drug users, arguing that punishment only exacerbates their trauma and alienation. Self-awareness and self-compassion are crucial elements in the healing process. Dr. Maté explores their importance, noting that many people with addictions feel a deep sense of shame, which prevents them from seeking help. Cultivating self-compassion, he suggests, can help individuals come to terms with their trauma and understand their addiction as a reaction to pain rather than a moral failing. This mindset shift can be instrumental in starting the healing process. Mindfulness and therapeutic approaches play a significant role in recovery. Dr. Maté advocates for mindfulness-based approaches in treatment, suggesting that practices like meditation can help people become more aware of their cravings and underlying emotions. He believes that therapy should focus on helping people reconnect with themselves, process their trauma, and build resilience. Maté draws on Eastern philosophies, as well as Western therapeutic methods, to suggest a holistic, compassionate approach to recovery. Healing and recovery are lifelong journeys. Recovery, according to Dr. Maté, is not a one-time solution, but a lifelong journey of self-awareness, healing, and reconnection with others. He emphasizes that healing involves addressing not only the individual, but also the societal structures that contribute to addiction. Maté advocates for a compassionate approach to policy reform, focusing on harm reduction, mental health support, and social services. Let's summarize the key takeaways. Addiction is a response to pain, rather than a moral failing or lack of willpower. Addiction is a way of coping with deep emotional pain, often rooted in trauma and childhood experiences. Trauma can disrupt healthy brain development, especially in children, leading to an increased vulnerability to addiction. Addiction is exacerbated by societal structures that emphasize competition, materialism, and punishment over support, which only worsens the addiction cycle. Effective treatment should involve compassion, self-awareness, and holistic support, focusing on treating the person, not just the addiction. Healing is an ongoing process that requires patience, support, and addressing root causes rather than symptoms alone.